Hi, I'm Ryan Falk, alumni of the Loma Linda University School of Dentistry. I'm here at the campus today to present the current year recipient of the ADA Preventive Dentist of the Year Award to Dr. Brian Novy. Dr. Novy was chosen by an ADA council based upon his belief, practice, and dedication to preventive dentistry. Over the next few moments, we will learn Dr. Novy's philosophy and implementation of preventive dentistry within his practice. Dr. Novy has a part-time practice and serves as a full-time assistant professor on the restorative faculty at Loma Linda University. He's a dynamic speaker and is frequently called upon to speak about preventive dentistry at both the national and international levels. It is here where he has become one of the leading experts in caries management. Dr. Novy, how did you feel when you received the award?
Well, at first I was really surprised, and then I was humbled that the American Dental Association would honor our practice with such an award. But in the end, it just really affirmed our passion as an office for prevention and for helping out patients as best we can.
What is preventive dentistry?
Preventive dentistry, or MI dentistry as I like to call it, which means minimum intervention, is all about not treating the hole in the tooth, which is the cavity, but treating the whole tooth and actually the whole person. And when you treat the cause of the disease and not just the symptoms, you keep teeth whole and you actually prevent tooth decay.
How do you treat the cause?
Well, the cause of oral diseases is multifactorial, which means that you have to understand how all the different pieces fit together. So once you understand all the parameters of a patient's mouth, the physiology of the mouth, the microbiology, and the anatomy, then you can actually really prevent oral disease.
In dental school, Brian Novy found his passion in dentistry. His passion flourished when he became interested in MI dentistry. He gave a talk one day on MI dentistry. His enthusiasm was so contagious, people were drawn to him. At that point, I knew he found his niche.
How have patients been receptive to this treatment?
I've actually found that patients are incredibly appreciative of this new paradigm in dentistry. And it actually gets to the root cause of the issue. And patients understand what the root cause is of their disease, they're better able to treat it. And patients really quickly realize that preventive dentistry is painless dentistry.
After receiving the Degoni Award for Excellence in Education, Dr. Novy used the grant money he received to start a public health research project evaluating the risk of tooth decay in Southern California children. Through this study, he hopes to determine the distinct parameters of tooth decay and the cutting-edge techniques that can be used to prevent this disease. Which tools and procedures do you find indispensable in your practice?
I've got a lot of tools that I use in MI dentistry, and the one that's, I don't think there's just one that I can pick that's my favorite. I like my monoclonal antibody test. I like my biofilm ATP meter. Fluoride varnish, chlorhexidine varnish are great, but I think the future of MI dentistry is the calcium phosphate technology, and I don't think I would have had so much success treating these patients without MI Paste and MI Paste Plus.
Dr. Novy is dedicated to community service. His spare time is devoted to helping the homeless. Currently, he volunteers at 3 Southern California dental clinics. Every year, he travels to Central America with dental students, where he provides dentistry to the people of Nicaragua. Locally, he runs a mobile dental clinic that travels to a homeless shelter that has helped over 200 people. Why is MI dentistry important to every professional?
I find MI dentistry so fulfilling because I know at the end of the day, I've done my best for my patients. I've treated them as a whole person. I didn't just treat the mouth. I treated a mouth attached to a human being. And that just brings a lot of satisfaction to my life, knowing that I gave my patients my best.
Dr. Novy, how profitable can preventive dentistry be?
I think a lot of dentists would be surprised that there actually is money to be made in preventive dentistry. Patients get really motivated and excited when they realize that you're doing everything you can for them. And when you get one person on board, they get their family and their friends on board, and your patient numbers increase exponentially.
As a fellow peer and former student of Dr. Novy, it has been my pleasure to present this to you. I hope that all of us will embrace MI dentistry and make it a part of our daily practice.